It often starts like the flu, a little fever, a sore throat, maybe a weird rash. But within days, skin starts to blister, eyes burn, lips peel, and suddenly you're in the ER being treated like a burn victim. I'm Dr. David Danish, a double board certified psychiatrist, and today we're talking about Stevens-Johnson syndrome, or SJS. It's rare, it's terrifying, but most importantly, it's preventable, especially if you know what to look for and what medications might cause it. Let's break this down. Most rashes I see from medications, mild, itchy, annoying, but they go away on their own, especially after you stop that medication. But SJS is different. It's your immune system going nuclear, and it usually shows up in the first few weeks of starting a new medication, including many I use in mental health, like certain mood stabilizers and seizure medications that neurologists use. Here is what sets SJS apart. The skin hurts, not just itches. The rash is dark, purplish, and quickly spreads. You might see blisters in your mucosal membranes, your mouth, your eyes, your private areas, the palms of your hands, the soles of your feet. And if your skin starts peeling off with a light rub, that's also a red flag. Compare that to a typical drug rash, which is flat, red, and usually fades with antihistamines. Those are usually not on your mucous membranes, and they're usually on your torso or your arms or legs. You need to stop the medication immediately and get medical help fast, and that means going to the ER. Now let me be clear. Stevens-Johnson syndrome is very rare. In fact, I've never seen it in the 100,000 patients that I've treated. And it happens in fewer than 1 in 10,000 exposures. But when it does happen, certain medications come up over and over again. The biggest culprits in my field, lamotrigine, otherwise known as Lamictal, especially when the dose is increased too quickly. Other medications in psychiatry are carbamazepine, oxcarbazepine, Depakote, otherwise known as valproic acid. Other medicines outside of psychiatry include phenytoin and phenobarbital. Even some antidepressants in psychiatry can theoretically cause this. Again, I've never seen it, but it depends on someone's genetics, and that plays an important role in the risk for Stevens-Johnson syndrome. In certain populations, especially people of Asian ancestry, genetics make SJS more likely. For example, if you have the HLA-B 1502 gene and take carbamazepine or lamotrigine, your risk skyrockets. That's why we often recommend genetic screening in certain populations before starting these medications. This means anybody with Asian ancestry. So let's just say you started a new medication and you're not feeling right. You've got a fever, your skin hurts, there's a strange rash spreading, or you've got blisters in your mouth. Here's what you do. Stop the medication right away. Call your prescriber and go to the ER right away. Ask if a skin biopsy is needed. It can confirm the diagnosis. In my clinic, especially with medications like lamotrigine, we go by one rule. Start low and go slow and educate before starting. We counsel every patient on the early signs of SJS, and we don't wait around if skin pain or mucosal symptoms appear. Most drug rashes are harmless, but the rare ones you do not want to miss. The bottom line is that Stevens-Johnson syndrome is incredibly rare. But if it happens, timing is everything. Fast recognition and quick action can literally save your skin and your life. And for the vast majority of patients, especially with thoughtful prescribing, the benefits of these medications still way outweigh the risks. So stay informed, stay alert, and don't be afraid of your treatment. Just be knowledgeable about it. I want you to actually see what Stevens-Johnson syndrome rashes actually look like and how they compare to a regular rash. So I put together a detailed visual guide in my Mind Vault section of my website, drdaviddanish.com. It includes real images of Stevens-Johnson syndrome versus benign rashes. It also includes what to monitor for in the first few weeks. I'll put that link in the description. If this helped you or someone you love, consider subscribing to my channel for more practical, research-backed videos on mental health and safety. Take care of your mind, your body, and of course, your skin.